Stop in the.
Good evening, all. Thanks for non-notice people to give me this opportunity today's evening as a speaker. And today's topic is optimizing diabetes management with IDegAsp initiation. This is my financial disclosure. Today's topic is insulin IDegAsp, a comprehensive insulin therapy is the option, and the second part is practical use of Ryzodec, which is nothing but the co-formulation of insulin IDegAsp. So, what are the indices for holistic choice of insulin therapy? One is simple regimen, and second one is a mealtime flexibility, and third one is a lower hypoglycemia, and fourth one is the convenience of device, and fifth one is a better quality of life, and sixth one is a cost effectiveness, and last and most important one is efficacy of the insulin. These are the indices for holistic choice of insulin therapy. So insulin dietetic aspart, a prudent choice. Yes. Insulin dietetic aspart, world's only co-formulation insulin, because it is a soluble combination of two soluble individual insulin analogs. It contains ultra long acting deglutec 70% and short acting aspart 30%. In the pharmaceutical formulation, insulin aspart elutes almost as hexamers and insulin degludec elutes as dihexamers. Insulin degludec and insulin aspart do not interact in the solution and in the subcutaneous tissue, thereby retaining their individual properties. Coming to the RSJ Clinical Practice Recommendations 2022 for the management of type 2 diabetes mellitus, insulin dietetic aspart is recommended as a choice for insulin initiation, IDegAsp versus other premix insulins, which causes less hypoglycemia, requires low dose, and causes less weight gain, and it has flexibility of administration before any large meal of the day and adaptable to various significant meals on different days. And coming to the efficacy of the IDegAsp. This there is a smart study. This study design shows adults with type 2 diabetes scheduled to start treatment with IDegAsp based on clinical judgment. The study conducted over 0 to 12 months and participants received IDegAsp for 1029 across 40 sites in India. Coming to the safety data, there is no confirmed or severe hypoglycemia after 3 months and 6 months and 12 months, and no adverse events, no serious adverse events, and no acute drug reactions, and casualties, severity, and outcomes are almost nil with IDegAsp. And coming to the efficacy data, assessment of the change of the glycosylated hemoglobin HbA1c and fasting plasma glucose and postprandial glucose baseline to 3 months, 6 months, and 12 months. Coming to the summary of the SMART study, there is effective HbA1c reduction, that is 1.8% HbA1c reduction seen with IDegAsp, and effective postprandial glucose control 82.5 milligrams per deciliter reduction post breakfast and 74.2 milligrams per deciliter reduction post lunch is seen with IDegAsp, and effective fasting plasma glucose control 50.4 milligrams per deciliter reduction from baseline, and improved safety with low risk of hypoglycemia. I am coming to the lower hypoglycemia. IDegAsp versus insulin glargine meta-analysis of randomized control trials, efficacy outcome, meta-analysis of mean HbA1c, fasting plasma glucose, and 9-point self-measured patient plasma glucose end of trial, that is self-measured plasma glucose 9 point means pre-breakfast 90 minutes after breakfast, pre-lunch 90 minutes after lunch, pre-dinner 90 minutes after dinner, bedtime 4 a.m. and next day pre-breakfast. So coming to the safety outcome, meta-analysis of confirmed hypoglycemia and nocturnal confirmed hypoglycemia. Inclusion criteria of these RCTs are randomized control trials, IDegAsp intervention, insulin glargine 100 units per ml or 300 units per ml control, and type 2 diabetes participants, adults with an HbA1c ranging from 7 to 11%, and the sample size of the study shall not be less than 20. And what are the exclusion criteria? These are non-randomized control trials and duplicate articles, individual case reports, and studies with no available data, the efficacy of glycemic control unable to determine from the trials, and diabetes with other diseases such as type 1 diabetes mellitus, secondary diabetes, cardiac disease, and impaired liver or severe renal disease. The results are superior mean HbA1c control with IDegAsp compared to the insulin glargine in end of the trial analysis, and lower nocturnal confirmed hypoglycemia with IDegAsp compared to the insulin glargine. So, IDegAsp significantly decreased the mean HbA1c and lower nocturnal confirmed hypoglycemia compared to the insulin glargine. Coming to the mealtime flexibility, IDegAsp is a simple solution that provides total control with mealtime flexibility. It is usually given with major meal of the day. Mealtime and meal related flexibility is most advantage with the IDegAsp. For the people traveling across time zones and shift workers and those who rely on healthcare providers to administer their insulin during home visit. It can be given with the breakfast or lunch or dinner, which is a major carbohydrate meal of the patient. So, flexibility in dosing. Insulin glargine U100, it should be initiated with 10 units once a day, any time of the day, but same time every day is needed. Coming to the insulin glargine U300, initiate with 0.2 units per kg once a day within 3 hours before or after the usual injection time is the flexibility. Coming to the IDegAsp, initiate with 10 units once a day, administer with any major meal or meals of the day. And coming to the simple regimen, RST Clinical Recommendations 2022 recommended IDegAsp as a choice for insulin initiation. IDegAsp versus other premix insulins causes less hypoglycemia, requires low dose, and causes less weight gain. Has a flexibility of administration before any large meal of the day, adaptable to various significant meals on different days. And coming to the better quality of life, which is the most important. So, the patient reported attitude, practice, satisfaction, and quality of life on insulin IDegAsp is conducted in a single center with, on type 2 diabetes individuals, adults from Jan 2017 to December 2020. 245 participants data is analyzed, and there is a questionnaire containing 26 questions, and it is assessed with a Likert scale. And number of questions questionnaire is like a demographic information, duration of insulin, diabetes status or initiation of insulin, current diabetes, and IDegAsp use status, ease of use, and quality of life, missed insulin dose, weight gain, and after since insulin start, frequency of blood sugar monitoring, like that. And coming to the quality of life, on insulin regulated by insulin aspart, 89.8% people reported improved quality of life with a reduced number of pricks. 86.7% found it comfortable to inject IDegAsp in different social situations, and 94.2% could manage their day-to-day activities better after initiating IDegAsp. So, flexibility in dosing. IDegAsp initiate with 10 units of once a day, administer with any major meal of the day. And coming to the cost effectiveness. Cost effectiveness basal bolus versus IDegAsp. A short-term cost effectiveness analysis based on step-by-step clinical trial over 1 year in India showed the IDegAsp is dominant, that is incremental dose benefit. Along with better flexibility and convenience, IDegAsp is found to be cost dominant compared to basal bolus therapy. IDegAsp is cost effective option because there is lower dose insulin dose requirement, lesser need for monitoring, that shows the incremental cost benefit, and lesser number of injections and lower risk of nocturnal hypoglycemia showed improved quality and adjusted life years. And coming to the convenience of the device. So, convenient and patient-friendly insulin pen devices of IDegAsp. IDegAsp is available as disposable insulin pen, that is flex touch pen, and it also used as a cartridge or pen fill in a durable insulin pen Novopen 4. So, disposable insulin pen, that is flex touch, there is no push button extension, unique injection mechanism, very low dose force, end of the dose, you can hear a click, accurate and consistent dosing. And coming to the durable insulin pen, accurate dose delivery for more than 5 years, low dose force to inject, easy dose adjustment, easy to read dose scale, quick and simple to use. So, all the holistic choice of indexes for the holistic choice of insulin therapy are met with IDegAsp, that is simple regimen, mealtime flexibility, and lower hypoglycemia, convenience of device, better quality of life, cost effectiveness, and efficacy are all proved with IDegAsp. And coming to the second part, practical use of Ryzodec. Ryzodec is nothing but IDegAsp. Practical use of Ryzodec. How to initiate IDegAsp? First one. When and how to intensify IDegAsp once a day to twice a day BID. How to switch from other insulin regimens to IDegAsp. Use of IDegAsp in special situations. First part is how to initiate IDegAsp. Administer with largest meal of the day. Initiate IDegAsp 10 units OD with the most carbohydrate heavy meal of the day, that is decided by the self-monitoring of glucose or the carbohydrate intake of the patient. And administer IDegAsp BID with two most carbohydrate heavy meal of the day. Meal size and postprandial glucose response should dictate the ratio of the two doses. It doesn't have to be 1:1 split. Timing of the IDegAsp dose. Main meal concept. So the main meal concept is most carbohydrate rich meal. Here there is a simple menu. First one contains 50 grams of carbohydrates, and second one is 30 grams of carbohydrate and 100 grams of carbohydrate. So when we give once a day insulin IDegAsp,